Thanks for joining us for another episode of When I Grow Up Wednesday. Have you ever wondered what it would be like to be a chiropractor? Well, Dr. Cripps joins us today to tell us just a little bit more about what it is like.
My name is Dr. Melanie Cripps. I'm a chiropractic physician and I'm the owner of Carthage Family Chiropractic. I knew I wanted to be a doctor. I wanted to be a veterinarian for a while, but I always knew I wanted to be in healthcare in some capacity. I was in college. I was a college athlete and I was already pre-med, so I wanted to be a doctor of some sort. I was doing some internships and following different medical doctors around, and I was having daily headaches, and they were affecting my practice and my performance. So I went to my medical doctor and I received some medication, and I was 21 years old maybe, and I just didn't want to be on that medication at that age. So someone had suggested I go to a chiropractor, and in 2 or 3 visits my headaches were gone. And I knew that's what I want to do. I want to help people heal without the use of drugs or surgery. Our bodies are capable of it, and I just wanted to help people realize that and to help them be their best potential of themselves. So it's 4 years of undergrad, so it requires a bachelor's degree to get into chiropractic school. And then chiropractic school is anywhere from about 3.5 to 4 years. That includes like an internship and externship to practice under a doc. It's I believe 4 rounds of national boards exams and getting licensed through your state. The most difficult part of my job is finding and relaying a serious medical condition to a patient. So we have patients that walk in with back pain and neck pain, and there's a lot of things that could happen in the body that can refer that pain. And it is my job to differentiate something that's musculoskeletal versus something that could be more serious, like cancer or an organ issue. And so we get extensive training in diagnostics in chiropractic school. And so finding something that doesn't correlate with what I perform, finding something that's a red flag, and having to relay that information to a patient, for me, is by far the hardest. I love what I do. I love what I do every day. It is, I think just all of it is rewarding to me. Helping people, watching people get better, watching them feel better, just the way they look when they get off the table and they're like, oh, I can stand up straight, I feel better, my headache's gone, I'm functioning better. Grandparents that tell me they can pick up their grandkids for the first time in years. Patients who are able to go back to work when they were having to take off from not being able to function. People's nutrition getting better. When people come in and say, I'm on less medication, my doctor said my blood pressure is great. Just watching people get their lives back is by far the most rewarding. So an average day would consist of opening the office, meeting with staff a little bit before, kind of going over my schedule for the day. And then when patients start, it starts. It's nonstop. And so it's me and staff going room to room, rooming patients, trying to work in patients every day. There's always someone I need to see that wasn't previously on our schedule. So there's always a wrench just thrown in the schedule, which is we just, try to see everyone that we can and help who we can. We have that, then we have our break, and then we start all over again in the second half, and we get through it. We just try to do as much as we can. We see about between 30 and 40 patients a day. Yeah. Awesome. And we are open 4 days a week. So it's about 150, 160 a week for the average week. Mm-hmm. I was lucky that I really liked biology, so thank goodness for that, because I had no idea what I wanted to do. But going back and talking to someone who would be that age, I would say definitely focus on your grades. You never know when that grade will separate you from someone else for an opportunity of a scholarship, for an opportunity to shadow someone, for an internship. There's all kinds of internships out there that sometimes will fall in your lap because you're prepared and somebody knows you. So definitely don't scoff at a grade here or just kind of blow off this class. Definitely go for as much as you can in the education field while you can. On the summers, when you're old enough to work, I would recommend doing something in that field. So at 16, I volunteered at a nursing home. So when I realized I knew I wanted to do this, it was because I had done so many things that taught me what I didn't want to do. And that is okay. You should do that. Do some things in the field that teach you what you don't want to do. So for me, that was nursing homework, that was an internship at Vanderbilt, that was a few different things. So take advantage of the opportunities that come to you as much as you can in your field, or just in a field where you can meet people, where you can talk to people. Another thing about being a doctor of any kind is that we are taught how to treat our patients and diagnose. We are not really taught how to run a business either. So any type of training you can get in that realm, do it. Anything that anyone's willing to teach you, take it. Learn how to speak in public, learn how to speak to people. You will get people from all walks of life coming to your office. And if they can't relate to you and they can't open up to you, they're probably not going to be a good patient because they don't feel comfortable telling you what's going on. So it is your job to extract that information from them and to earn their trust. I was told when I got to chiropractic school, don't do it for the money. And I will say that to anyone going into healthcare at this point in my career, don't do it for the money. You kind of know the doctors are in it for the money, and you kind of know the ones that aren't. And I think across the board in your career, if you're good at what you do, the rest will follow. If you're doing it for the money, number one, you may be really disappointed. And number two, people are going to see through that. No matter what path you choose, just be genuine and do it for the reason that you love it. Because if you don't love it, you're going to get bored and you're probably not going to be very good at it.
Thanks so much to Dr. Cripps at Carthage Family Chiropractic for joining us today and explaining what being a chiropractor is like. We hope you've enjoyed this episode of When I Grow Up Wednesday.